The Millennium Development Goals are 8 strict planned-out goals that developing countries and regions should achieve by 2015 to help the people in need. Goal 1 is to eradicate extreme hunger. Goal 2 is to achieve universal primary education. Goal 3 promotes gender equality and empower women. Goal 4 is to reduce child mortality. Goal 5 is to improve maternal health. Goal 6 is to combat HIV, AIDS, malaria, and other diseases. Goal 7 is to ensure environmental sustainability, and Goal 8 is to develop a global partnership for development. Achieving these goals requires hard work, but they are realistic. Especially South Africa's situation has improved a lot. The UN has sent volunteer doctors to ensure healthcare, and in addition to that, the Millennium Development Goals focus on developing a sustainable government that is willing to improve their situation. It is important to heal from the past and look forward to democratic values, social justice, and fundamental human rights-based society. And to achieve these goals, it is most important to bring over the message and lay out the foundations for a sustainable government. In 1994, the Reconstruction and Development Program addressed the immense socio-economic problems, challenges, and backlogs that can emerge from apartheid neglect. Therefore, they started focusing on delivery schedules for health, education, and electrification. In 1996, the growth, employment, and redistribution aimed to achieve competitive, fast-growing economy that created sufficient jobs by focusing on the redistribution of income and opportunities.
Although poverty is rising in sub-Saharan Africa, South Africa's poverty rate is decreasing. The government has created social wage packages intended to reduce the cost of living of the poor. There are different forms of packages like free healthcare, child support, old age pension, no-fee schooling, and provision of basic services such as electricity, water, and sewage. Indigent or poor and needy households are entitled to a monthly free 6 kiloliters of water, 50 kilowatt hours of electricity, 50 worth of sanitation, sewage, and refuse removal. The number of households receiving water dropped from 6.2 million in 2009 to 4.4 million households in 2012. Because of the drop, more indigent households were targeted at 71% of them receiving services. Local governments within South Africa have created integrated development programs over the years. South Africa achieved and has come close to achieving many set goals that dealt with poverty. Although poverty rate is decreasing, the level of inequality within the country remains the same. More attention must be directed to malnutrition and child health. If South Africa help the unemployment problem, this could decrease the need for social assistance programs. All children of schooling age, boys and girls, must achieve universal primary education by 2015, as well as making higher education accessible and progressively available to its citizens. 58% of South Africa's learners are in no-fee schooling zones. South Africa has a very high rates of primary education enrollment. In 2009, the education enrollment rate was at 98%, and the completion rate was at 93.8%. The literacy rate is also up at 93%. South Africa's rates show stronger gender equality. There is the same proportion of boys to girls in schooling. South Africa has been able to achieve the goal before 2015. They are now working on improving the quality of schooling, especially in the historically black and underperforming section of South Africa's schooling system. The government has already begun initiatives as well as developing new ones.
Since 1994, the balance between girls and boys in primary and secondary education has evened out a lot. The GPI for secondary education now lays at 1:1 instead of 1.13 to 1. This goal has been achieved, and the ratio of literate females to literate males between 15 and 24 has been achieved as well. Other goals have also been achieved, or are most likely to be achieved, but only the female share of non-agricultural wage employment is struggling to be achieved. It depends on a domesticated indicator type. On the secondary education level, there tend to be more girls than boys because more boys are repeating earlier grades. In 2011, 57.9% were female of tertiary students, but they were underrepresented among students at a master's level. Those improvements have happened because there has been a bigger representation of the female gender in politics, and a wide range of laws, policies, programs, and practices have been established to promote gender equality. There have been programs with extracurricular activities, especially for children, to reinforce family ties, socialization at home, and reduce the risk of violence. Even with this goal, the Millennium Development Goals have improved South Africa's situation. The under 5 mortality rate per 1,000 births have dropped from 59 to 53 and are likely to drop down to 20. In addition to that, the infant mortality rate has dropped from 54 to 38, and the goal of reaching 18 is likely to achieve as well. The proportion of 1-year-old children immunized against measles and the immunization coverage under 1 year of age has nearly improved up to 100%, and therefore it is most likely to achieve this important goal. Achieving goals in reducing child mortality require ensuring that necessary policies and implementation strategies are in place to prevent malnutrition, and intensification of immunization coverage and access to free healthcare facilities. South Africans' interventions in health are very promising to improve infant mortality, but they are not very sufficient, and therefore the South African Parliament keeps stressing the importance of health needs. The negotiated service delivery agreement came up with a plan for maternal, newborn, child, and women's health. In addition to that, there have been a lot of campaigns for accelerated reduction of maternal and child mortality that focus on the quality of data and extension of wide-ranging health interventions.
Despite this investment in public health, there is a high and increasing level of maternal mortality in South Africa. Notwithstanding the fact that over 90% of pregnant women currently have access to antenatal care, and the fact that with a contraceptive prevalence of over 60%, South Africa has relatively high contraceptive prevalence rate. Of concern remains the current level of maternal mortality ratio, which is far higher than the 2015 MDG 5 target of 38 maternal deaths per 100,000 live births. It is evident that maternal mortality is both a multidimensional health and broader development challenge, and that improved sexual and reproductive health is also dependent on a range of other factors, including education, decent work, safety, clean water and sanitation, and adequate transport facilities. South Africa has the largest population of people living with HIV and AIDS, with an estimated 5.6 million people living with the disease in 2012. The HIV epidemic severely hampers the country's ability to achieve several development goals, including the target of halting and reversing tuberculosis by 2015. South Africa has the third highest tuberculosis burden in the world. HIV prevalence levels are still high in South Africa compared to other countries in northern, western, and middle Africa. However, it would appear that the prevalence of HIV has stabilized in the country. Encouraging as the decline might be, the differential infection rates point to predominance in rural provinces attributed to gender power relations. Even more worrisome are the emergent relationships that expose young girls to HIV because of gender power inequalities with older male sexual partners.
Since 1994, environmental issues have moved into the socio-political arena. They bring together human rights, access to natural resources, social justice, equity, and sustainability. In the last 15 years, the government has focused on prioritizing people's needs while safeguarding the country's natural assets. Between April 1994 and March 2005, approximately 2.4 million housing subsidies were approved. During the same period, 1.74 million housing units were built. South Africa does have significant environmental challenges, specifically its dependence on environmentally harmful coal-based energy production. No strategy for environmental sustainability can be successful without better monitoring. Currently, however, monitoring systems for water flows and quality, air quality, deforestation, and other land degradation are inadequate. Sustained investments in strengthening environmental monitoring systems will thus be essential. An important mechanism for implementing national strategies is a set of multilateral environmental agreements and conventions, such as the Convention on Biological Diversity, the UN Convention to Combat Desertification, the Ramsar Wetland Convention, and the UN Framework Convention on Climate Change. More funding and targeted technical support need to be made available to implement these agreements. In 2004, the South African government undertook to halve poverty and unemployment by 2014 its Accelerated and Shared Growth Initiative. To meet its targets, the government estimated that the level of economic growth would need to average 4.5% or higher during the period 2005 to 2009, and 6% or higher during the period 2010 through to 2014. So far, on a real basis, the economy has grown at an average annual rate of 3.2% between 2005 and 2009, and thus, growth targets have not been met. In relation to strengthening global partnerships, South Africa has repeatedly opened up trade, especially to LDCs and developing countries. Her trade, and in particular imports from both LDCs and developing countries, have increased, with the LDC's share of imports rising from less than 1% in 2002 to just under 6% in 2008, while imports from developing countries increased to a high of 47% in 2009. South Africa has also made great progress in telecommunications for the masses, with the percentage of South Africans with access to a cell phone repeatedly approaching 9 out of 10.